New COVID surge comes as hospitals across the country, including here in the St. Louis area, struggle to find nurses. News 4's Kim St. is covering this story for us tonight live from SLU Hospital in Midtown. Kim, what's the situation there?
So Corey, right now SSM Health is telling us that nurse staffing levels are safe, but it is always trying to recruit more. Tonight, a study from the Missouri State Board of Nursing is raising some concerns about nurse shortages across the state, especially in rural areas.
Nurses have been needed perhaps more than ever over the last year and a half.
There's a lot of trauma and stress that nurses have gone through, and of course families and patients have gone through. And it doesn't seem to be over yet.
That's Sue McFarland, an associate professor of nursing for Webster University and a practicing nurse. She says interest in the university's nursing program is on the rise, following a small dip in enrollment in January.
Our classroom discussions often center around concerns surrounding the nursing shortage, as well as new nurses and how we can better prepare them so that they're not having some sort of reality shock when they get to the reality of taking care of patients on their own and being responsible for that.
A study by the Missouri State Board of Nursing found that rural areas in Missouri have 40% fewer nurses than metropolitan areas, citing more job opportunities and higher pay as two reasons for the disparity. The study also found 31% of all nurses in Missouri are older than 54, raising concern about long-term availability.
The average nurse is not early 20s. So we're really also trying to figure out ways to make nursing more appealing to a younger generation.
SSM Health tells News 4 it partners with local high schools and colleges to develop aspiring nurses and offers a return to practice program. The program helps St. Louis area nurses brush up on their skills and get back into the industry after taking some time off. McFarland says seeing nursing enrollment numbers at Webster University rising gives her hope.
I think of our students as the future educators and leaders that are going to be tackling this issue, because I think it's going to be an ongoing issue.
According to the Bureau of Health Workforce, there are about 15 nurses per every 1,000 people here in the state of Missouri. And just to give you some context with that, we rank out of the entire country 41, Missouri does. So that means that actually here in the state, we are far better and have a smaller ratio, a better ratio than most parts of the country as far as patient to nurse ratio. Live outside SLU Hospital, Kim St. News 4.